Okay, the second bill that we have for considerations, members, is House File 3893, Representative Nadeau. May I have a motion from you to get Chair Scott's bill before the committee?
I move the bill.
There you go. Representative Nadeau moves that House File 3893 be recommended and to be referred to the Committee of Judicial Finance and Civil Law. We have the bill before us, Representative Scott. Welcome to our committee. Our goal is to do this bill in roughly 15 minutes because we have the some fun other bills behind us. So with that, go ahead, Representative Scott, and thank you.
Thank you, Mr. Chair, and thank you, members. I don't think I've ever submitted a bill to, or heard a bill in front of the Health Committee, so thanks for having me.
It feels good,
really
doesn't
nervous.
it, Representative Scott?
I'm really nervous, so
Yeah, okay.
bear with me. No. I think
Treats?
this is,
Where's the treats?
I brought treats for you.
Oh, okay.
I can help you with that.
Okay, there you go. Go ahead, I'm sorry, Representative Scott.
thank you. Members, there are a lot of bills this session that deal with AI, and this is one of them. I think many of us have seen the very scary and troubling news stories about people that are having chatbots be their best friend and end up taking their own lives and different things. So the Minnesota Psychological Society or organization several of them got together this fall and summer and started to try to get ahead of this. So that's what House File 3893 does. And Mr. Chair, I'll go ahead with my intro of the bill, and then should we take up the amendment?
Yes.
Okay, perfect. All
Okay,
right.
so what I'm going to do is, we have, if you're not against it, we're going to take up that amendment right now.
Okay, we can do the amendment, then I'll do the rest of my intro here.
Oh, okay, let's get the bill in the format that you want. We do have an amendment labeled A2. Representative Nadeau, would you like to move that amendment?
I will move the A2.
Representative Nadeau moves the amendment labeled as A2. Representative Scott, please tell us about your amendment.
This amendment is a collaboration of different stakeholders that were involved and just that expressed particular concerns with particular areas of the bill. And so this takes those concerns into consideration. And this also adds in a piece on informed consent.
Okay. Representative Nadeau has moved amendment A2. Any further discussion on the A2 amendment? Okay, hearing none, seeing none. Those in favor signify by saying aye.
Aye.
Aye. Those opposed? The motion does prevail. The amendment is adopted. And you had some more introduction before
Yes.
we go to the testifier.
I will move quickly, Mr. Chair. House File 3893 would regulate artificial intelligence from engaging in psychotherapy and counseling with human beings. Legislation has passed in Illinois, Utah, and Colorado. Similar bills are pending in many other states. The U.S. Congress seems to have little bipartisan agreement these days, but they do agree that AI being involved in mental health therapy and counseling is deeply problematic. As I said, a group of Minnesota health professionals, mental health professionals, have been working for many months with legislators to draft a bill that will control the use of artificial intelligence in mental health therapy settings. Therapy should be provided by an educated, trained, and licensed mental health professional, not a chatbot. We have all read the horrifying news stories of people who have committed suicide after being encouraged to do so by the computer they've been talking with. Members, a few of these articles are in your packets. One of those, a recent Wall Street Journal account, talks about a suicide of a 30-year-old man. He was experiencing serious trouble in his marriage and fell in love with his computer. The computer urged him to commit suicide so they could be together digitally. If he had been in the care of an actual human being and therapist, perhaps he would be alive today. Big Tech's answer that their systems are getting better as it learns more are not good enough. AI are supercomputers. They are not human beings who go through many years of education, thousands of hours of training, including supervised therapy, and passing rigorous and comprehensive exams in their field. All mental health professionals licensed to perform psychotherapy have at least a master's degree, and in the case of a psychologist or psychiatrist, a doctorate in psychology or medicine. And then I would like to hand it off now to my testifiers, Mr. Chair.
Today, we have 4 testifiers, 90 seconds. You will be given a 30-second notice before your 90 seconds is up. And please state your name. We have Dr. Steve
Girardo.
Thank you. I would not have got that. Go ahead, please. State your name and 90 seconds, sir.
Thank you, Chairman Becker. My name is Dr. Stephen Girardo. I'm a licensed psychologist, been in practice for over 3 decades now. I am a past president of the American Psychological Association. I've been co-chair of the legislative committee for well over a decade. I am the federal advocacy coordinator with APA, and I'm on the healthcare advisory committee for the National Small Business Association. So I know a lot about healthcare. And it is a great concern that AI is moving into the healthcare space. One of the interesting things that I find that's really frightening for me is that everything else in the healthcare space is required to prove that first it does no harm, and then that it does benefit, that has actual benefit. This is a technology that's trying to move into this space that is not doing that. Are there forms of computer-based interventions that are? Yes, there are some FDA-approved computer-based interventions that are not part of this bill because they're not AI. They're not assessing people, they're not prescribing to people, they're not intervening.
30-second warning.
And so it's not the same. One complaint about the bill is that we don't define things really carefully. We shouldn't have to define things, and if we define specific things, then we're playing whack-a-mole forever. I think that AI and the computer companies, the big computer companies, need to prove no harm and benefit first, and then they should be allowed into the system.
Thank you. We have, next is Aaron Miskey, and then after that is Nigel Linner. I know I slaughtered that, but go ahead, 90 seconds, sir.
Mr. Chair, my name is Eric Mischie. I'm the CEO of SAVE, Suicide Awareness Voices of Education. We are a 36-year-old Minnesota-based suicide prevention nonprofit organization. We enthusiastically endorse this legislation. We know firsthand from the work that we are doing with parents and children all throughout the country that AI chatbots are, in many cases, a death sentence for far too many people that are using what is really a nascent emerging technology. I want to be very clear. We are not anti-technology. We are not Luddites. But the reality is the big tech companies that have created the social media platforms that we hear all too often that are resulting in children who are dying by suicide as a result of their interaction with these platforms, sextortion, sex trafficking, purchasing illegal drugs, choking games, et cetera, pales in comparison to the harms that AI chatbots can bring upon children as these technologies mimic humans. I want to be clear about something. These are not human entities. These are algorithms. They are machines mimicking as therapists. The reality is that artificial intelligence and chatbots may someday be a powerful tool in suicide prevention, but that future is not yet today. It is not now. We need to have powerful regulation to protect Minnesotans from the harms of these artificial intelligent beings that don't exist. The fact of the matter is that we are at a place where regulation is not simply something that we should look at as a possibility. It's something that people in this state who are struggling need as a reality. Thank you.
Okay, thank you. And on Zoom, we have Nija.
Nina Linero.
Okay, we did not pass on that one, so thank you.
No worries.
Okay, you got 90 seconds, and state your name, please, and share us your testimony, please.
Sure. Nina Lanero with TechNet. Good afternoon, co-chairs Backer and Bierman and members of the committee. Again, I am Nina Lanero, Executive Director for TechNet in Illinois and Midwest. Thank you for the opportunity to speak with you today on House File 3893. TechNet supports thoughtful approaches to regulating artificial intelligence in sensitive settings like psychotherapy. We agree that strong patient protections and maintaining the central role of licensed professionals are critical. We also appreciate Representative Scott's willingness to engage with us on this issue. Our comments focus on ensuring the bill is clear, workable, and does not unintentionally limit responsible, supervised uses of technology. First, we recommend narrowing the definition of therapeutic communication so it clearly applies to clinical therapy services rather than potentially sweeping in general wellness or educational tools. Second, we suggest clarifying references to emotional distress by focusing more specifically on
30-second
suicidal or
warning.
self-harm ideation, providing clear guidance when safeguards should apply. Third, we encourage revisions to allow AI tools under professional supervision to support administrative functions like tracking patient progress. Without this clarity, the bill may unintentionally restrict tools that help providers deliver consistent care. Finally, we recommend clarifying that AI should not independently determine treatment decisions while still allowing it to assist in drafting routine, professionally reviewed communications. Overall, our goal is to ensure the bill provides clear, actionable standards because ambiguity can create confusion rather than compliance. We've outlined these recommendations in the written testimony submitted to the committee and red lines shared directly with the bill author, and we look forward to continuing our work with Representative Scott and the bill proponents. Thank you for your time and consideration.
Thank you. Ashley Yos with Woodland.
Hi, I'm Ashley Cho.
Oh, there you go. Zoom.
Thank you.
Sorry, go ahead, Ashley.
Okay. I am also a licensed psychologist in the state of Minnesota, and I am the CEO of Woodland Centers. We are a CCBHC serving rural Minnesota. I want to begin by acknowledging that I share the concerns behind this bill. Fully autonomous, corporate-developed AI tools that present themselves as mental health providers do pose a real risk. Minnesotans should be protected from unsafe, unregulated AI systems that could cause harm. However, I respectfully urge the committee not to advance House File 3893 as it is written. The bill aims to address large technology companies offering direct-to-consumer AI mental health services, but the regulatory mechanism in this bill does not actually apply to those companies. It creates new requirements for licensed mental health professionals, people like myself who already follow strict ethical, legal, and professional standards. That includes ensuring the tools that we use are safe and that we avoid harm to our clients, and that would include the use of AI. Licensing boards already have authority to investigate and to act on these standards when they are not met by professionals.
30-second warning.
Woodland Centers is a member of MACMIP, March, and Meritap, and while I am not speaking on behalf of those associations, many of the providers in those associations share the same concerns about the unintended consequences of a bill like this for access in clinical practice. The issues raised in House File 3893 are better addressed through consumer protection and technology policy, not professional licensing statutes. Minnesota has already moved in this direction through legislation like House File 1991 that regulates AI products themselves. So I encourage the committee to consider approaches that more directly target the source of the risk, such as regulating those companies that develop AI mental health tools, prohibiting AI systems from presenting themselves as licensed clinicians, and requiring transparency when somebody is interacting with AI. So these steps would help protect Minnesotans while preserving access to care and supporting our clinicians to use technology responsibly. Thank you so much for your time.
Thank you. Representative Keeler, you have your question next. Oh, I'm sorry, I had to ask if there's testifiers in the audience. My mistake. Is there anyone in the audience who wishes to testify on House File 3893? Okay. And I'm not aware of any other amendments, correct? No, cool. Okay, so further discussions, we have Representative Keeler. You're first on deck.
Thank you, Chair. Thank you, Representative Scott. I'm a co-author on this bill. Thank you for spending the time with me over the interim to really learn about this. I guess the first question I have when I was looking through the packet, NAMI doesn't have an opinion on this, whether for or against. Is anybody from NAMI here that we can ask them their take on this bill?
NAMI's been quiet since Sue Aberholden left.
It looks like no help there, Representative Keeler.
Okay. Thanks, Chair. The a huge alliance that focuses on mental health, so if maybe we could see where they stand on this, that would be helpful. I also just want to say, suicide prevention is something that is really hard for a lot of us to talk about, so I want to be mindful that we do share the disclaimer that if you or anybody you know is considering this as an option, 988 is a tool that we have, making sure that people know that we have a suicide hotline that we can use as well. But with this, I think a couple things have come up that I just want to note some things on the record. A lot of people have talked to me about this because they're like, oh, it's so bad for kids. We don't want kids to be a part of this. And I agree. I think, though, too, it's really important to just name a couple things that, one, in the state of Minnesota in 2024, we have data that show that suicide is something that is happening in this state. We know over 800 individuals took their own lives in 2024. 80% of them are male. And so I think that we also need to be really mindful on, in society, how we treat our males, how we raise our sons, to really not lean into supports. We also know that suicide is 2 times as much in the rural communities as it is in the metro. And so we need to make sure that there's, we talk a lot about rural access, and often people are like, just go to telemedicine. And I worry about that a lot, because we can't just say rural access is staying alive because we're going to add computers to do the job. But more than that is that the age range that we're seeing high rates of suicide are age 50 to 54 and 80 to 84. And so making sure that the conversation isn't just around protecting our kids, which it obviously needs to be, but there are these other components that we need to just make sure, the ombudsperson for aging, are they a part of this conversation? Because it's just a really big population that utilizes these services. And I think some of our elders in our older generation, they don't know how to tell the difference in a chat box, as well as maybe some of our younger generation. And, we see that in fraud, and we see that in these other areas. So making sure we're taking the age range and the geographic spread into consideration. I just want to name that. But thank you for doing the work. Thank you for doing the amendment, continuing to listen to advocates as we do this, because I agree, we are not at the place that robots should be leaning into helping our most vulnerable populations when they're in a crisis moment. Thank you.
Okay, and our last set of questions on this file is with Representative Gilman.
Thank you, Chair, and thank you for the great conversation here. Really quick, just want to turn to in our packet, we got a great letter from Minnesota Alliance of Rural Addiction Treatment Programs. I think about just in business and in life how AI is helping assist compile notes in meetings, different things like that. So I think there's a couple things in this, and I know that this is a starting point. The one paragraph that really caught my eye, and I just want to ask this question, I don't know who would have this answer, but it says, lastly, it's worth noting that the state and federal privacy laws applicable to behavioral health information prohibit the use of open source or public AI tools. And the Minnesota's licensing boards possess authority to discipline licensees who misuse AI. And it goes into, to more there. So if that authority is already happening, my concern for rural Minnesota and folks like Woodland Centers they're seeing so many people from so many communities, and they're using tools to help them, but not take the place of a licensed health professional. How can we incorporate that? That's big things, and especially I think about rural Minnesota and just mental health, trying to figure out how we can support people who are doing the work. I think of, a doctor who used to have somebody to help take notes for them, or they would record. They would have a recording device, and now they're doing that with the assistance of AI. So I just want to know, I think as this keeps moving through, we really need to factor in rural folks with, and what are the provisions that we already have under licensure? Thank you.
Comment, go ahead.
Thank you, Chair Becker, and thank you for your questions. The amendment actually covers a lot of what you were just talking about, in that it's really looking at trying to allow for what's already there, that there already was transcription services and things like that. The idea is that those transcriptions cannot be, the content quality, like pulling out the important bits of information from that, should not be done by the AI. One of the things that I know as a clinician is that when you get a medical record from somebody, you get a record of everything that's in there. And if you're getting a record that literally is a transcription of every session, all of those sessions are meaningless because they don't have a summary. And that summary is a clinician job, not an AI job, because an AI is going to pick things very confidently with not necessarily being accurate. And so we're not saying don't use transcription services, but also if it's going to use passive listening, that's where the informed consent is coming in, where it's letting the patient know that a computer is listening and is transcribing the information, and that information and where that's going to be held and the information security for it. That's the informed consent. As to the bill, we're not just talking about kids. The two examples of suicide we actually talked about were people that were adults and were just as easily kind of talked into it. One of the things that I am seeing, and this is my great honor in my profession, is I am seeing people at their worst moments. And I am trying to help them to navigate their way through those worst moments. Do we really want to program a computer algorithm to help somebody through their worst moments because they're not up to it? And AI companies saying that they're not being accurate. And I come back to my same point, is they should have to prove a lack of harm and a benefit for what they're trying to do. And one of the things the bill talks about is that AI chatbots should have filters within them to look for, it's clinical words like depression, anxiety, suicide, chemical dependency, and flag them and be required to come forward and say, I am a computer, I am not able to help with this, you need to speak to somebody who's a caring partner in your life or a mental health professional. And that's what we're talking about in trying to get the broader AI. This is not a bill for the licensing boards. Very little of any of this is going to come before a licensing board. It would be if they're using something that integrates the AI or chatbot into determining things and deciding things. That's the only time it would ever come up. It really is putting the onus on the companies to do it.
Okay. Representative Scott, final words before we take a vote.
Thank you, Mr. Chair, and thank you, members, for the good hearing and the good questions. We will continue to take feedback on this and make changes where we think that they can be made. And just want to thank the members again for your time on a really important topic.
Okay, thank you. Representative Nadeau moves that House File 3893 as amended be recommended to be referred to the Committee of Judicial Finance and Civil Law. All those in favor say aye. Aye. Those opposed say nay.
Nay.
The motion does prevail, and as amended is recommended to be referred to the Committee of Judicial Finance and Civil Law.